Welcome back to TV5 News at 9. Great Lakes Bay Health Centers is working to make sure our rural communities are taken care of. Joining us this morning to tell us more, we have Senior Vice President Angela Williams. Thanks for being here.
Thank you for inviting us once again.
Of course, always a pleasure. So tell me, what's most important to know about accessing health care in the more rural parts of Michigan?
Well, we're excited to share what Great Lakes does to make a difference in our rural communities. Many of our communities are located in service areas that are considered rural, where access to health care is very limited. So what people in the listening audience need to know is 1 in 5 residents in the U.S. live in rural areas. These residents are more likely to die from prematurely based upon 5 of the leading causes of death, which include heart disease, stroke, unintentional injuries, and chronic lower respiratory diseases, as well as other chronic health issues. Many times poor nutrition, as well as other health conditions such as obesity and high blood pressure, lead to complications and premature death.
So lots to be aware of, for sure.
Lots to be aware of, for sure.
Tell me, how do your health centers strive to address some of these barriers when it comes to health care?
We provide equal access to health care. So in these areas, our communities strive rather, to bring essential services directly to where people live, to try to alleviate some of the long travel, the long wait for appointments. We believe that healthy individuals make stronger families, schools, and help the economy. And also our services reduce emergency room visits, and we help to manage that chronic care related to diabetes, hypertension, and other chronic conditions.
That's great.
Yeah.
And tell me more about the kind of services you guys offer.
We offer a wide range of services, not only just medical care, primary care. We offer behavioral health services, and our centers that are located in rural health areas also provide dental along with pharmaceutical services. So if you're seeing your doctor and he prescribes medication, we make arrangements for your medications to be delivered to you or mailed to you, because we do not have any pharmacies in these areas where we're located, but we make services accessible.
Right. And situations occur where maybe a family might be experiencing a financial hardship, as well as an illness that could cause them not to seek health care due to the potential cost.
Yes.
How can the service provided by your health centers support them?
Well, we keep health care affordable. We proudly accept Medicaid. We offer a sliding scale fee for those who are uninsured. And a lot of people don't realize that they can get care even if they've lost their insurance or they're between jobs. We help people to enroll in health care coverage, and we connect them to other services that they need. We believe in fair access to care and keeping the care affordable. No one is turned away from our services based upon their ability to pay.
That's great. And remind us again where your primary health care centers are located.
Our health care centers are located in Thumb. We have Thumb Community Health Center, which is located in Bad Axe. Imlay City, we have a community health center, and in Shiawassee, our Shiawassee Health Care Center is located in Owasso.
All right. And finally, let's discuss community-based health care. What does that refer to? Well,
community-based health care means that for us, our staff live in the same communities where we serve our patients. So they understand the challenges, they are dedicated, and we're not just treating illnesses. We are cultivating relationships and supporting families to prolong lifelong wellness. We also have community health workers who can help families if they're in need of other services, such as food deserts are really common in rural areas. And so if a family is in need of some support for those type of services, we have people who can help navigate those services.
That's awesome.
Yep.
Well, Angela, anything else you want people to be aware of right now?
Yes, I do have to encourage everyone to take care of their general health care needs and those of their families. We always accept new patients. Everyone is welcome, regardless, as I said before, regardless of their ability to pay. Most of our patients are Medicaid or Medicare. We take all insurances, and what's more crucial right now in the healthcare environment is measles outbreak.
Yes, it's
And
very
this
big
is,
right now.
Yes, and that is very, very a critical health issue. So I want to encourage families to become educated on the importance of getting vaccinated. Get your children and your babies vaccinated for measles, mumps, rubella. Simple vaccine is available, but the most important is getting credible information about the measles.
Yes.
And sadly, it hurts my heart as a nurse to see that we are in a critical state right now with so many outbreaks of measles, and it's all related to not being vaccinated.
Right.
Or vaccinated.
Yes.
Yes.
Exactly. And you can stay with TV5 for more updates on the measles outbreak. Of course, we've been updating you guys on that every morning here. But Angela, thank you so much. Is there anything else I left out?
I don't think I think we covered everything today, but we just, our biggest, I feel like our rural health areas are a well-kept secret, is why it's important that people know that you don't have to drive to Saginaw or Bay County. There are locations within your service area where you reside or you work.
Fantastic. Well, thank you so much for being here this morning.
You.
You can find more information on today's topic by going to the hot link section of our website, WNEM.com.